Hello students, today we will be discussing the parotid gland. This question has been asked several times in RGUHS examination. You can take a pic of this slide. This is a 10 marker which is asked several times in the university exam. In this slide you can see the 5 markers and 3 markers from this chapter parotid region. Now since yours is the CBME curriculum, you'll first be given a case and questions will be asked based on that. So let us see this case. A 18-year-old male patient presents to the OPD with history of fever, pain and swelling in front of his left ear since past 2 days. Now what is your diagnosis? Name the involved structure. Anatomical basis for severe pain in this region, the external features of the involved structure, contents, applied aspects and the secretomotor pathway of the involved structure. Now, an hint in this case is that there is severe pain and swelling in front of his ear. So, in front of the ear you have the parotid gland. Swelling and fever in this region is an indication of viral infection, mumps. So, we will first discuss the parotid gland that will help you answer all this question. So, the diagnosis will be mumps. The involved structure will be the parotid gland. Why do you have severe pain in this region? We'll be discussing shortly. Now, let us go to the parotid gland. Now students, parotid gland, the region what you are seeing here, that is the parotid gland. You can see it is in front of the ear. It is the largest serous salivary gland. Now parotid, what is the meaning of this? Para means around, otic means ear. So this gland, which is the parotid gland, it is around the ear. That is why it is called as parotid. Now, I want to tell you the nerve supply of the face. So you can see that the skin of the face entirely is supplied by the branches of fifth cranial nerve, which is the trigeminal nerve. Except for the skin in the angle of the jaw. This will be supplied by great auricular nerve. This point is very important when we will discuss the Fraze syndrome. So what you need to remember now is the skin in the entire face is supplied by the fifth cranial nerve, that is the trigeminal nerve, except for the skin near the angle of the jaw, which is supplied by great auricular nerve. We'll move on to the next slide. In this slide, we are going to discuss the capsule of the parotid gland. Now we can see here, this is our parotid gland. Now what actually happens is the investing layer of the deep cervical fascia. Once it approaches the angle of the mandible and in between the mastoid process, what actually happens to this investing layer of deep cervical fascia is that it will split into 2 layers. One is the superficial layer, another is the deep layer. Now what actually happens to the superficial layer is that it is attached to the zygomatic arch. So the superficial lamina or the superficial layer will be attached to the zygomatic arch. What happens to the deep layer? It will be attached to the styloid process, what you are seeing here. So in this diagram, you can appreciate the investing layer of the deep cervical fascia is splitting into superficial lamina and attaching to the zygomatic arch, whereas the deep lamina is attached to the styloid process. Now, there is a muscle in this region and that muscle is known as masseter muscle. Our superficial lamina, what actually happens is it blends with the epimysium of the masseter muscle. And this fascia is called as parotidomasseteric fascia. Why parotidomasseteric? Because it winds, it encloses a parotid gland and it blends with epimysium of the masseter. That is why it's called as paretidomesenteric fascia. Now, this fascia is very thick and it is unyielding. It is very tough fascia. Now, what happens is, if there is any infection or inflammation of the parotid gland, it will swell. Now, what happens? This fascia, the paretidomesenteric fascia, is extremely tough and unyielding. And furthermore, when you move the jaw, this fascia will stretch the gland. That is why any swelling or any inflammation in this parotid gland will produce extreme pain. This is the answer for the third question, the anatomical basis for severe pain. Your answer for this question will be the superficial lamina, that is the paretidomesenteric fascia. It is extremely tough and unyielding. That is why you have severe pain when the parotid gland swells or enlarges. Now, this is the same slide just to explain that the investing layer of the deep cervical fascia will split into two lamina, superficial lamina and the deep lamina. As you already know, superficial lamina attached to the zygomatic arch and it blends with the epimysium of the muscle, and that is known as masseter muscle. That is why it is called as paretidomesenteric fascia. Whereas the deep lamina, this lamina will be attached to the styloid process. Now, this is to show that the deep lamina is attached to the styloid process. This is the angle of the mandible. This part of the fascia is thickened to form stylomandibular ligament. It is this ligament which separates the parotid gland and submandibular salivary gland. Now we have to study the external features of this gland. You can appreciate that this gland looks like a three-sided pyramid. Now you have the structure here. What you're seeing here, that is the base of the gland, also called as superior surface. What you're seeing here, that is the apex of the gland. Now we will see the anterior border. So what you're seeing here, the border you're seeing here, that is the anterior border. The border you're seeing here, that is the posterior border. Now the surface you're seeing here, this is the superficial surface. Now if we take a cross section here and see in this image, now see here students, this is the mandible, right? So this is anterior aspect, this is the mastoid, therefore this is the posterior aspect. Now we can see that this is the anterior border, this is the posterior border. The surface between the anterior border and the posterior border, this surface will be your superficial surface. Now, how to see the medial border? I will tell you in the next slide, where is our medial border. Now students, in order to feel the medial border, what you have to do is, you will have to insert your finger in between the angle of the mandible and the mastoid process. Your fingers will approach to the midline structure, that is the pharynx. So, near the pharynx, you will have a border that is known as medial border. As already discussed, here you will have the anterior border. In this image, this is the anterior border. Here you will have the posterior border. In this image, you will have the posterior border here. As already discussed, this is the medial border or the pharyngeal border. Now the surface between the anterior and the posterior border will be the superficial surface. Now the surface between anterior border and the medial border will be anteromedial surface. The surface between posterior border and the medial border will be posteromedial surface. Now, as already discussed, this is the apex of the gland, this is the base of the gland, anterior border, posterior border. Again the same slide, which is the anterior border, posterior border, medial or the pharyngeal border. To revise once again, medial border, anterior border, posterior border, superficial surface. This will be your anteromedial surface. This will be your posteromedial surface. Now the relations. Now you can see that the apex of the gland, this is the apex of the gland. It actually will overlap a muscle here, and that muscle is known as posterior belly of digastric. What are the structures related to the apex of the gland? You can see here it is related to a nerve here, and that nerve is called as cervical branch of the facial nerve. You can also appreciate the anterior and posterior division of retromandibular vein. So these two structures are related to apex of the parotid gland. Now we will see the relations of the base or the superior surface. Now what you are seeing here, that is the base of the parotid gland. We have already studied that this is the apex of the gland, which is related to cervical branch of the facial nerve and the two divisions of retromandibular vein. Now we will be seeing the relations of the base of the parotid gland. You can see that it is related to a nerve here. This is the auriculotemporal nerve, and it is related to two arteries, namely superficial temporal artery and the vein. It is also related to the external acoustic meatus. So what are the structures at the base of the parotid gland? So you have the auriculotemporal nerve and superficial temporal vessels and external acoustic meatus. That is the relation of the base. Now we will see the relation of superficial surface. As already discussed, this superficial surface is in between the anterior border and the posterior border. So this surface is nothing but the superficial surface. So what is the relation? First you will get the skin. Superficial surface is that surface which you see on the side of your face. So first you will get the skin. Next you will get the superficial fascia, along with that a muscle called as platysma. Then already discussed that a capsule of the parotid gland splits into superficial lamina called as parotidomesenteric fascia. So these are the relations of the superficial surface of the gland. Now we will discuss the relation of the anteromedial surface. You already know this surface lies in between the anterior border and the medial border. So this surface will be your anteromedial surface. You can see in this diagram here the relation on the anteromedial surface. So you will have the mandible bone here, which you can see, and on the outside you have a muscle called as masseter. On the inside you have the medial pterygoid muscle. So anteromedial aspect, it is related to the ramus of the mandible, masseter and the medial pterygoid. It is from this surface that the facial nerve will come out and give its terminal branches from the anterior border. We will be looking at this in next few slides. Now we will discuss about the posteromedial surface. Very simple. It's in between the posterior border and the medial border. So this surface here, what you are seeing, that is the posteromedial surface. Now posteriorly you have the mastoid process, which you have already seen, and it is related to two muscles, sternocleidomastoid, and this muscle is posterior belly of digastric. So our posteromedial surface is related to the mandible and two muscles, sternocleidomastoid and posterior belly of digastric. You also have the styloid process and its related muscles there. And one point to note here is our external carotid artery and facial nerve will enter the gland through the posteromedial surface. In this slide, you can see the relations on the anterior border. So this is the anterior border of the parotid gland. Let us see what are the structures emerging from this border. So you can see here, these are the terminal branches of the facial nerve. You can also see the parotid duct here. So let us see what are the relations of the anterior border of the parotid gland. So anterior border is related to the temporal branch of the facial nerve. It is related to the transverse facial artery. It is related to the zygomatic branch of the facial nerve, upper buccal branch. Then you have the parotid duct here. You have the lower buccal branch, marginal mandibular nerve. So these are the structures present in the anterior border of the parotid gland. So mainly you will have the terminal branches of the facial nerve. Along with that you have a transverse facial artery and you have the parotid duct. Along with that you have the accessory parotid gland. Now in the posterior border, so you can see here, this is the posterior border of the parotid gland. It is related to a branch of facial nerve, that is a posterior auricular nerve, and it overlaps this muscle, which is the sternocleidomastoid muscle. Now we have to see the medial border or the pharyngeal border. This is the pharyngeal border. Now it is related to the wall of the pharynx. Medial border is related to the wall of the pharynx. So that's all in part 1. In part 2, we will be discussing another case scenario and discuss the further aspect of the parotid gland. Thank you so much for watching this video. Kindly watch part 2 for the continuity.